Welcome to Orthodontic Smiles, the podcast designed for all dentists and their staffs who practice orthodontics. This podcast is brought to you by the American Orthodontics Society. This episode of Orthodontic Smiles podcast is being brought to you from Dallas, Texas. We went to Dallas this weekend to the meeting of the American Orthodontics Society Board of Diplomates. We have this meeting once a year where we examine our candidates for fellowship and for the diplomates, as well as have two remarkable speakers. But it gave me the opportunity to interview our new president of the American Orthodontics Society, who was in attendance. Just before we get to this, let me give you a message from one of our sponsors. With innovation, quality, patient comfort, and efficiency as their goal, Henry Schein Orthodontics has once again achieved a new and exciting breakthrough in aligner therapy. Introducing a clearly different aligner system, a comprehensive aesthetic solution for adults and teens. The SLX Clear Aligner System is uniquely clear, provides an excellent fit, and offers numerous treatment and workflow efficiencies. With over 50,000 patients treated with this innovative aligner technology, doctors and patients can be confident in the SLX aligner performance for a full range of minor, moderate, and comprehensive treatments. Jumpstart your SLX cases with the Carrier Motion Appliance to provide the most efficient and aesthetic treatment solution available. For more information, contact your Henry Schein representative or email aligners@henryschein.com. Welcome to Orthodontic Smiles podcast. Today we're very lucky to have the upcoming president of the American Orthodontics Society, Dr. Alan Rotberg. Quite unique that Dr. Rotberg has been selected as their incoming president since he is a resident of Mexico City. And it's going to be, I think, the very first time that we've had a non-American president, but we think so much of him that I think he's going to do a fantastic job for the American Orthodontics Society. So thank you for being here, Alan. I appreciate it.
Thank you. Thank you for having me.
Well, this is a big year for you because you're kind of learning how it is to be president. You're hearing all the stuff you're going to end up having to do as president. And but I'd like to step back a little ways and kind of talk about you a little bit. I'd like to know, where were you born and how did you go to school, and give me the process of how you ended up being a pediatric dentist that is a diplomat of the American Orthodontics Society. How did it all start?
Okay, well, I went to school, all my high school, and before that I went to school in Mexico City. After that I applied to college in the U.S., and I was accepted at Stanford University, and I didn't really know what I wanted to do back then as far as what career I wanted to
Well, you
follow.
got into one of the most prestigious universities in the country, and you didn't know what you wanted to do?
No, I didn't know. Part of the reason why I left was because usually in Mexico, when you finish high school, you have to choose what career you want to start, and I wasn't sure what I wanted to start. So I was pretty good student, so I decided to apply to the U.S. I got into Stanford. Was a biological sciences major, and as I was finishing my Stanford career, I decided to get into dentistry because my dad is a dentist, and I figured a lot of the stuff that my dad liked, I liked as well.
He's one of the most prestigious dentists in the entire country of Mexico, and a pediatric dentist as well, right?
Correct. He's a pediatric dentist, and he's the founder of the Mexican Academy of Pediatric Dentistry. First president as well of that academy.
My goodness. And you didn't know what you wanted to be.
I did.
He was telling you right there who you should have been, and you ended up, thank God, making him happy. I'm sure that you became a pediatric dentist. So where did you do your pediatric training?
My pediatric training was done in the university in Mexico, at the Technological University of Mexico, Unitec.
Mm-hmm.
And after I finished that, I started practicing with my dad. I did that for quite a few years, and we did a lot of ortho, early ortho, and first phase and second phase ortho in the clinic. And there was an orthodontist working there with us. And so I got to do a lot of orthodontics along with the orthodontist who was working in our office.
In Mexico, is there any adversarial relationship between pediatric dentists and orthodontists since you were doing early treatment in the practice with an orthodontist?
Yeah, there's a lot of, it's the same as in the States, a lot of adversarial relationships, and they don't like us and we don't like them either. But most pediatric dentists in Mexico hire orthodontists to do the ortho for them, and they're associated with them.
Okay, so it's a good financial relationship that you have, and as long as they're making money, they're not complaining.
Exactly.
Right, that's good. But there, we talked before. I remember sitting down with you, and you told me that it's such a difficult process for a Mexican dentist to learn orthodontics in Mexico, and it's if you're not trained in the university. So tell me about that, because it was quite unique the way you had to go about getting trained. There's a system. Explain that.
Yeah, I mean, they teach very little ortho in the undergraduate dental school.
Mm-hmm.
So when you finish your career as a dentist, you're basically not trained to do any ortho,
right,
or very basic ortho. When you go through the specialty in pediatric dentistry, you get a lot more training, but still you're not very comfortable doing good quality second phase ortho with most of your patients. So even though I was watching the orthodontist in my office doing a lot of the second phase stuff that patients needed, I was not comfortable doing that and following just what I was watching the orthodontist doing. So I was teaching ortho as well in the university to the pediatric dentistry residents in another university. And I realized that I had to get more training, especially when the orthodontist left the office.
Yeah.
And he didn't leave the office in a very nice way, taking a lot of the patients with him. So in Mexico, we don't sign contracts where they prohibit orthodontists or whatever other dentist is working for another dentist from doing those, taking the patients with them.
But a general practitioner can learn orthodontics, but he has to go and to a special orthodontist that it does the training?
In Mexico, it's called diplomados, which are, the translation is diplomates, but it's not. It's not the equivalent of a diplomate of the AOS, for instance.
Uh-huh.
It's just taking courses once a week, maybe for a year,
from a specific orthodontist that's in practice.
From any dentist who decides to offer a diplomate or diplomado in orthodontics for Mexican general dentists or pediatric dentists or whoever wants to take their courses. But the training is very basic. It's not even close to a specialty or a residence in
so they make money doing the training of general dentists in this process.
Right.
So that, I assume, is limiting to organizations that teach orthodontics in Mexico.
It's
those guys would not want organizations coming in to teach orthodontics because that would take away their extra income.
The orthodontists wouldn't want that. They don't like that in Mexico, and they don't like also pediatric dentists or any other specialty besides them practicing orthodontics. The same as in the States.
Same as in the States, but yet there are some people that do the diplomáticos.
Yeah, a lot of people do the diplomados. Some of those diplomados somehow have gotten permission to be recognized as a specialty, even though they're not. So that lures people to train in a way that they're not well trained.
I understand.
Yeah.
So that brought you to the United States to get more training in orthodontics, and how did that all come about?
Well, it was mostly influenced by Dr. Lenny Carapeza. We had followed him extensively doing the phase 1 treatment with his utility arches, and I had been doing that for a long time. But I knew I needed more training on the second phase treatment, and I knew that he was a member of the AOS. But mostly, I just decided to call him up and ask him if I could take his course in Wayland, Massachusetts. So I went up there, and from there I learned from fellow classmates that about the AOS, and I heard about all that the AOS offers, and so I was so grateful that there was this opportunity to learn much more in-depth ortho through the AOS.
Great.
And so that's how I started taking all the courses in the AOS.
And you've taken many hours because you are a diplomate, and you can't even sit for the diplomate position unless you've had 500 hours of continuing education. And I kind of suspect you have more than 500 hours because I've seen some of your work, and it's absolutely beautiful. So it really was something you wanted to learn, and the American Orthodontics Society gave you that opportunity.
Exactly. I had taken ortho courses in ADA annual meetings, but they were very limiting. The orthodontists who used to give those lectures would not give many details. Some were really hostile to giving more details on what I was expecting to receive from them.
Do you have difficulty getting into the United States to take courses?
No.
You've always had an easy back and forth transfer of. Is there any concern that you might have with closing the border?
No.
Because you still think you'd be able to get through.
Yeah. So the plane goes over the wall.
So. That's true. You're in the plane. That's different than walking here, I guess.
Yeah.
So it's interesting to me that you have spent so much extra time outside of your country getting an education, and a quality one at that. So has it benefited you in your practice?
Enormously. Nowadays, most people that come into my practice are looking for ortho.
Really?
That I provide them with ortho and not pediatric dentistry.
Really?
So,
do you do pediatric dentistry?
I still do a lot. Yeah. For me, it's important to have a pediatric dentistry patient pool because
that's where you get your patients.
Exactly.
So same with me.
Yes.
All right. So with that, I assume, are you still practicing with your dad?
No, he left about 5 years ago to practice on his own. He treats mostly disabled patients.
I see. 2
floors down in the same building.
In the same building. That's great. So you're full-time practice, and give me an idea for the listeners out there. How many patients do you see a day?
On average, I would say 30, 35 patients.
Okay.
Yeah.
And most of those are ortho patients?
Most of them are ortho patients. I have two dentists, ladies who help me with my patients. So I write down the instructions, what I want to get done, and what I want to see do the next on the next visit for each patient. And so they start working. They read the instructions, and they start working and doing what was written.
And they're dentists.
And they're dentists. They're general dentists, but one of them took a diplomado, which doesn't seem to have helped her much. But
yeah.
But
well, I'm sure she's getting great training from you.
Yeah.
So that's it should be an advantage for her. At some point, she's going to know how to do this very well, and hope she doesn't leave you.
I hope so. I try to. Well, I tell her everything I know. But
good deal.
Yeah.
Well, you're the new president, so talk to me a little bit about your journey to the presidency. You've served on the board of directors. And then you were elected by the General Assembly of the American Orthodontics Society to be our new president. And that will happen in September, I'm thinking, in Washington, D.C. Isn't that interesting? So this is going to be a real challenge. I know that when I was president, it was a tremendous challenge, but it's hopefully some years for some of our presidents, there are many, many difficulties. And then some years it goes very smooth and you don't have too many. I pray that this will be the same for you, that it'll be an easy year for you, but you have to be prepared for everything. And I think you are. Obviously the membership felt like you were, and you seem to get along well with everyone, and everyone respects you, which is wonderful. You have any ideas or anything new that you'd like to bring to the association?
Well, mostly I would like to get more of the basic training ortho techniques that I feel that we're missing a little bit of, like basic mechanics that. Mulligan type mechanics that we need to teach more of, which I think is very basic. To get back to doing more ortho and less of other stuff that's going on that's in vogue in dentistry, like sleep apnea and stuff like that. And
so you like the spit on your hands orthodontics, right? So I mean that's. You like to get into the mouth and actually do the orthodontics and the mechanical end of the orthodontics. That's your passion,
right?
I see.
Yeah.
And I think all of us feel the same way. But there are some things coming out that are so different that we're having to take time to process these new things that we're getting involved in. For instance, give me your opinion about Align Orthodontics.
Okay, Align Orthodontics is becoming huge, I think.
Yeah.
It works. I used to think that it didn't work very well, and that a lot of people were having to be finished with ortho, which I'm sure it still does. But the trick there has been that you need to be well trained in doing spin in your hand orthodontics, and you have to be real good and have a lot of experience in diagnosis and in treatment planning before you go into Align orthodontics.
So you don't think it's as simple as just taking an impression and sending it off to these companies for the computer to tell you what to do?
No, I think they're going to have a lot of problems arising from that. Although, I mean, my point is that you have to be well trained in doing a lot of orthodontics to be successful with the aligners. A lot of AOS members came to the AOS because they were having trouble with the aligners.
It's true. When they first came out, they weren't very good, and we could never. Many of the members that were doing a lot of aligners were not finishing the cases the way they wanted to, and so they had to quickly learn some bracketing orthodontics to be able to finish up the cases that they had started.
Yeah. And
it became a big problem there for a long time. But my understanding, and Gordon Christensen on our podcast had mentioned it as well, that the aligners now that are being used are much better than they used to be. And there's even some more advances that are coming out with aligners. So let's see what the future holds. I happen to be a believer in the fact that as an organization, the American Orthodontics Society, that we need to get involved a little bit with aligners so that it doesn't pass us by. Because if in fact the aligners then become the treatment of choice, I want to make sure our membership is involved in that treatment and they can draw on use of aligners as well as complete bracketing. So we've always been a bracket, non-extraction organization, and I think that we have to change a little bit just to take in all the advances. Let me ask you a couple other questions about treatment, because I'm curious if certain things are popular in Mexico. Obviously, we see Henry Schein Orthodontics going to Mexico and in the South American and Central American countries teaching the sagittal first concept of orthodontics. I'm sure in Mexico City, I think they've already done that, been there and taught that. Has that been accepted well by the Mexican orthodontists?
Well, I can't speak too much about what the orthodontists are doing in Mexico because I don't go to their meetings. But
how do you subscribe to that type of treatment? Have you used the carriers? And
I have used them. Yes, I do like the whole. I like the whole system. I like it more for its orthopedic use and its orthodontic use. But I respectfully, I rather do the expansion first, and then go to the sagittal.
I think that seems to be the consensus that I'm hearing as I talk to so many people in whether they be orthodontists or general practitioners. The consensus seems to be that they're still sticking by the transverse first instead of sagittal first, and I really don't know what would be better or not better. I listened to Carrier. We've interviewed him on the podcast, and he just feels like he wants to treat the case sagittal first because that's when the patient is most excited about getting some orthodontic appliances, and he feels like they will wear the rubber bands that are necessary with his appliance much more consistently at the beginning than towards the end.
Yeah, well, my experience, my sister practices with me at the office, and she's given the Carrier motion appliance at the beginning of the treatments, and in one case the patient left because they were so unhappy using them at the beginning. So
the patient left because they were unhappy using the appliance because they had to wear the rubber bands. Is that the reason?
Yeah.
Okay.
They just didn't like the whole notion of starting that way with the treatment.
They wanted braces.
They wanted braces, and they wanted other ways to fix whatever needed fixed.
Yeah. So sometimes parents come in with a certain idea in their mind, and we're not making those kinds of suggestions, so they can't. I think you have to sit down with your sister and suggest to her that you need to spend a little bit more time helping the patient understand the treatment in the future, and maybe they'll be more willing to accept it and do those kinds of treatments. Kids, I tend to see those kids that if I do use the sagittal, it's true, right at the very beginning, they do wear the rubber bands a lot more than they do later on. And there's no question about that. But that was Dr. Carrier's reasoning for going sagittal first. They're now suggesting, Alan, I think you've seen this when we've talked to some of the people over at Henry Schein Orthodontics, is that they're now using the sagittal first concept and then going directly into Align products.
Yeah.
And I'm thinking that may be a good compromise to treatment. If you get the anterior posterior positioning of the teeth correctly, then the Align product can do the rest.
Yeah. They're using tats as well with the aligners.
Yes, true.
Which whatever helps. They're doing expansions before the aligners as well.
Well, that's sometimes absolutely necessary. So they're getting that. When Carriere mentioned that, he did say that in the younger kids, he does use RPEs to expand them before he does use the motion appliance. That's the way I feel. I do a lot of early treatment orthodontics, and so expansion is a really, really important part of my treatment. So if I can expand the case and I've got a nice, pretty arch, then if I'm class 2, I can use a motion appliance and bring that lower jaw forward, open an airway, which is really good. We now have studies that show that when you use a motion appliance, that we actually increase the airway more than we thought, because the mandible is coming forward. And that's why the Carriere appliance is so good for like skeletal class 2s. Mm-hmm. It treats them very, very quickly and very easily. Yeah. So it's interesting. I know that they've spent a lot of time in the South American and Central American countries teaching about the Carriere motion. It stands to reason they would, since Dr. Carriere is Spanish and would have an easy conversation with those countries. I'm just wondering how well people are accepting the concept.
Well, it seems to be working in Mexico. It's like many other things that are fat driven. So I'm not sure if that's going to catch on for a long time, or if it's going to replace other philosophies. But yeah, I know that orthodontists in Mexico are using it.
Well, let me ask you this question. This is interesting to me because I've never really asked anybody if you can make it comparable to help the audience understand. Is orthodontics in Mexico more expensive than the United States or less expensive than the United States?
Less expensive.
Less expensive.
It's about maybe a third in the best of cases.
A third in American dollars.
In American dollars.
It's a third less than here.
Yeah. Okay. In most countries, I would think it's the same story. Mm-hmm. In the U.S., it's probably the most expensive country in the world to get treated for orthodontics. I do some lingual orthodontics, which I charge much more for, especially if they're comprehensive cases, and especially if they're extraction cases, mm-hmm. which I'm starting to do this year after doing maybe 3 or 4 years of lingual orthodontics, mostly to align and for aesthetic reasons.
Is it for older patients that you're doing that for?
Adult patients, yes.
Adult patients.
Adults.
So you're actually seeing adults as well in your pedo practice?
Yes.
Okay. Is that common?
No, but they're asking for me for ortho services.
So the kids get their orthodontic services, and then the parents ask you if you can do their treatment as well. Sometimes
that happens. Mostly there are new patients that are reaching me from my website.
Oh.
They see that I do lingual ortho as well as Invisalign, and they're looking for me to do the lingual because they just don't feel that they're going to be able to use the aligners 24/7 as it is required from them. So they say no. I don't want my braces to show, and I want to get good treatment done, and I just want it to be done with lingual orthodontics. That's
something I've never done. I've never done lingual orthodontics. I've seen it. It's never enticed me to learn it. I mean, I'm sure it's good, and it's still around. I mean, it's not as predominant as it used to be, but it's great to hear that you are that experienced, that you're good at all of it. Align, straight wire, and lingual orthodontics. That's great.
Yeah, I love doing lingual. I mean, I don't love the strain on my back.
Yeah,
I'm doing it, and they're longer appointments, and the treatments are also a little longer.
So you charge more for those?
So I charge more for those.
I understand.
Yeah,
but
not nearly as much as it is charged in the U.S. But yeah, I did.
Well, you've given me a different look at orthodontics from an international perspective. I think it's interesting because you bring an international flavor to the American Orthodontics Society, and I think our American orthodontics needs to listen to other countries and the way they do things. It's not always, look how much we've learned from Eastern European countries about functional appliances. We need to keep our ears open to the international market so that we can learn from them. I always think it's really a good thing to learn from other people as well. So I thank you very much for being on Orthodontic Smiles podcast. And I can't wait for you to be our new president. And I know you're going to do a great job. Congratulations to you. And thank you for being on Orthodontic Smiles podcast.
Hi, my name's Dr. Brad Williams, and I've practiced orthodontics for over 35 years, and over those years, I've had some fantastic teachers like Dr. Bill Wyatt, Dr. Bob Garrity, Dr. Dave Jackson, and many, many more. And I'm honored now to be teaching orthodontics to a whole new generation of general and pediatric dentists. I want to personally invite you to enroll in one of my basic or intermediate hands-on courses through the American Orthodontics Society. We are committed to provide your entire staff the support and training you need to launch orthodontics in your pediatric or general dental practice. And to make the hands-on experience in my classes the best possible, I've partnered with an outstanding and very ethical company called OrthoArch to provide all the orthodontic supplies my students need. When my students start treating patients in their offices, they too will benefit, as I have, in partnering with OrthoArch for all their orthodontic supply needs. You can contact OrthoArch at www.orthoarch.com. See you in class.
This is your host, Dr. Ed Gonzalez. I want to thank you for listening to Orthodontic Smiles today. If you enjoyed our broadcast, please click the subscribe button. We'll be in touch with you in the future about our further broadcasts. Thanks for listening.